In this video, we'll discuss about human herpes virus for Epstein-Barr virus. Epstein-Barr virus only affect B cells or B lymphocytes. It is also known as kissing disease. It is presented in saliva of adult. While kissing, it is transmitted from one person to another. So mode of transmission is kissing. Pathogenesis sources saliva of infected person. It will go to that oropharynx. It will go to that oropharynx and B cells. B cell having receptor CD21. So it will bind with B cells. It will go inside and it will have a gene LMP1. LMP1 gene, it will integrated with the human DNA. It is activating JAK-STAT, which causes proliferation. This increases the chances of B cell lymphoma. Then acquisitions of T814 translocation causes Burkitt lymphoma. This is human virus presented on saliva. There are the tonsil of human. So virus enter mouth via kissing. This is the saliva of another person. So it enter, go to the tonsil. There in tonsil B lymphocytes present. This is the B lymphocytes. It having nucleus DNA. Then it will enter inside. The virus have a gene LMP1. This gene will go inside of that nucleus. Then it will this one is cytoplasm. After that it will enter to nucleus and integrate with the human DNA. Due to this integration, JAK-STAT pathway activated. JAK-STAT pathway got activated. Because of this activation, these cell will undergo immortality. It will divided uncontrolled mitosis, not die. If the cell survive forever due to some other carcinogenesis, there is the mutation inside that cell. Here mutation will happen. T814, it will leads to Burkitt lymphoma. So B cells, Epstein-Barr virus having CD21 receptors, it will enter B cells, it will undergo immortal. Okay, here 814. Translocation leads to Burkitt lymphoma. MYC immunoglobulin formation. So here MYC immunoglobulin formation leads to increased expression of pro-growth gene. So it leads to Burkitt lymphoma. Clinical conditions. It leads to Burkitt lymphoma and also causes nasopharyngeal carcinoma, gastric carcinoma, T cell lymphoma, NK cell lymphoma. Most common symptoms are sore throat. It also leads to infectious mononucleosis. Also called glandular fever. A laboratory diagnosis, blood examination during the initial phase may show leukopenia. Later, there is a predominant leukocytosis with the appearance of abnormal mononuclear cell. One more important thing, fall funnel test. Fall funnel test. Heterophil antibodies reaction. Then laboratory diagnosis, other method like virus isolation, PCR and serology, like previous method only, herpes simplex virus 1 and 2, like same method only. Then treatment, no antiviral drugs is given. Uncomplicated mononucleosis treatment is symptomatic. Next virus, human herpes virus type 5, that is cytomegalovirus CMC, formerly known as salivary gland virus. It is the largest among the herpes virus. Herpes virus family, this one is the largest one. Once affected an individual carrier cytomegalovirus forever. Reservoir human, the transmission via three ways, saliva, sexual and parental. Then pathogenesis, cytomegalovirus, it will go to the salivary gland of epithelial cell. It will causes persistent infection in fibroblast, epithelial cell and macrophages and produce latency in the mononuclear cell. What are the diseases it will causes? It will go to that fetus. It will cause cytomegalic inclusion disease. Perinatally, it is asymptomatic and behind neonatal period, it causes cytomegalovirus mononucleosis. And in compromised host after especially renal transplant, it causes maximum infection because of drop of immunity. Beyond a neonatal period, most common presentation in cytomegalovirus mononucleosis. Immunocompromised host, maximum risk of infection after kidney transplant is between 1 to 4th month after transplantation. Then common symptoms, fever, leukopenia, hepatosplenomegaly. Laboratory diagnosis, microscopy. Demonstration of cytomegalic cell in microscope, intranuclear inclusion bodies look like owl eye. Okay, this one look like owl eyes, two eyes of owl. This is the cell, this one is the nucleus. This is the cell, this one is the nucleus. Inside nucleus, these bodies presented, inclusion bodies are presented. Then laboratory diagnosis, like previous method only, virus isolation, PCR and serology. Treatment, cancyclovir, foscarnet. These are the two antiviral drugs is available. Then human herpes virus type 6, it causing Sixth disease, this one not important, it causes exanthum saphitum. Sixth disease. Next one is human herpes virus. 7, most common clinical manifestation of childhood. It causing fever and seizure. Then 8, human herpes virus. 8, this one associated with Kaposi sarcoma. HSV8 has also been linked with Castleman disease. Castleman disease. Thanks for watching.